we're going to go into a totally different direction here in the interest of talking a bit about, again, the revelation that has occurred in the field here in the last week. And I invite Dr. Chin as well to join me if you'd like, to talk about aducanumab, which again is the first FDA approved medication for the treatment of Alzheimer's since 2003. And it, as I mentioned, is the first disease modifying medication. And again, by disease modifying, what's important to emphasize is that the previous medications and the existing medications that are sometimes prescribed are designed to try to slow down the process of cognitive decline, but they don't, in other words, manage symptoms, but they don't impact the underlying cellular abnormalities. They don't change the beta amyloid deposition. They don't change tau, which are the main cellular abnormalities. On the flip side, aducanumab does consistently show, if you look at the data that across 2 clinical trials that they ran, that it does significantly reduce beta amyloid. The challenge historically with aducanumab has been that many drugs in the past have shown that they can decrease beta amyloid at a cellular level, but the hurdle that all of them have faced is to say whether that actually makes a clinical difference. In other words, does it actually slow cognitive decline and functional decline? And so the concerns with aducanumab are, that there just isn't consistent evidence that it does do those things. It also does pose a challenge when we think about the cost, which is about $56,000 a year just for the drug that does not include the infusion. So it actually has to be infused into the body. And there is some risk of cerebral hemorrhage and swelling, and that risk doubles if somebody has any kind of a genetic risk for Alzheimer's. It's also a concern that it was approved, if you look at the package insert, to treat Alzheimer's of any severity. And in the studies that were done, in only one of the 2 studies, it showed that there were some mild positive changes that occurred, but only in patients who had very mild symptoms at a very high dose of the drug. So we'll talk about next steps as well, but Dr. Chin, I just wanted to invite you as well to share your thoughts, because this is something our community has been waiting for, is more medication. And so we want to embrace it and be very excited about it, but we also want to think about it in a balanced way.
I think, first of all, I think your slide is really helpful here. So first of all, thank you for showing that, Michelle.
Yeah.
And I would agree, there's a lot of debate and a lot of mixed feelings about it, but it doesn't take away the significance of this approval. And it
Yes.
is approved. And I mean, so one way or the other, the FDA weighed the evidence and they listened to experts and they said, well, this matters right now, and that we need something. And while this drug is it's not a cure and it doesn't stop the progression, at least the evidence they're able to show is that there is slowing over the 18-month period. For me, I also think it's significant because it changes the way the field is going to be moving. There are going to be more drugs that come out. It's never usually the first drug that's the big one. It's the number 2 or number 3 that comes afterwards. Some drug has to pave the way and go through all these hurdles. And that happens to be aducanumab. But I can tell you, we already have clinical trials underway with other drugs that work similarly, that remove that protein from the brain. And so this approval has sort of set the stage for these other drugs to now be more heavily investigated, but to also consider the other causes. So this drug removes amyloid, but we're still trying to explore and understand, well, what is it that generates more amyloid? And so it isn't that we're turning a blind eye to those other causes like inflammation and oxidation and these other things. It's just that now we have a framework, both in a clinical world and now in a research world, to do this. And so one of the things that I just always caution people is we still have to wait for CMS and Medicare to determine if they'll approve the payment of this. And they have the authority to also determine which individuals will be eligible. The studies were done in individuals with mild cognitive impairment and mild stage dementia, but the FDA approved it for anyone who has, quote, Alzheimer's disease. And so there's a lot of things that need to go into that. How do you identify this Alzheimer's disease protein? Which category of individuals is most likely to receive the greatest benefit? And then, of course, process. How does the hospital or healthcare system implement it? But I can promise you, every hospital institution is already looking at how could this be done. And so there's a lot of things happening behind the scenes, but certainly whether a provider agrees or disagrees with the FDA decision, it's still an exciting time, and it is a pivotal time in Alzheimer's disease care.
Absolutely. I really, I couldn't agree with that more. It's sort of an inflection point, I think, for our discipline and for this from the standpoint of developing hope and knowing, as you said to Dr. Chin, that this is a process that now is galvanized to move in a different direction as well. And so it is an exciting time. And one of the pieces as well that, I love about your statement as well is that, this is something that is kind of game changing when we think about future medications too. And the fact that medication development is an iterative process. It does take a lot of trial and error, and it's a historic undertaking. So it's exciting from that standpoint for sure.
The one something that I like to tell my patients, because in clinic, and I'm sure Dr. Braun's experiencing the same thing, people are asking about this. What does this mean? What does this mean? Well, the same way that Dr. Braun showed that great pyramid where we talked about the diet, right? But what is truly the foundation of that diet? Well, it is sort of these lifestyle behaviors, which we would all argue, right, how to be well, how to address our holistic health. And that doesn't change with this drug. In fact, hopefully it means that people who are in the best shape physically, mentally, socially are going to do better when these treatments come out. And so for me, it doesn't change the emphasis of my discussions with patients in the community, because I still think these are the foundational tenets. The information that Dr. Braun's talking about, this diet. I don't know if you can see it. Oh no, I don't have it in the background anymore. I bought, I don't know if I should really be advertising this, but I bought multiple copies of this so that I could give this to my clinical team, because this is really the foundation of wellness, of slowing aging changes, or really being in your best performance. That does not change with a drug, right? So we can do a lot for diabetes and high blood pressure, and those medications are still needed, but it doesn't change that the foods that we eat, the sleep that we get, the exercise that we engage in, the people that we care about, those are still going to be the cornerstone. And the same is true for aducanumab or the next drug that comes down the line. And I would argue there are going to be studies looking at people who receive the other drugs and these other lifestyle interventions and seeing if there's going to be a change. And I would suspect there's going to be more benefit for people who are conscientious about living the best life they can.
Yeah, I think that's so beautifully said, because there is this magic to synergy that we continue to see across studies, where when we're integrating multiple components, and like you said, Dr. Chin, if we can look at the medications in the context of that and see potentially maybe more of a synergistic effect, that would be so exciting. So I also wanted to just share some of my contact information if you have questions beyond today.